Like most puppies, Zoe is energetic and insatiably curious. When SHES outside, the 3-month-old yellow Labrador keeps her nose pointed to the ground, sniffing things, tackling flowers and chewing on random objects without hesitation. Such was the case on a recent morning, when owner Peter Tebow took Zoe out for a walk on the wooded neighborhood street in Andover, Mass. At some point, he noticed Zoe had lunged toward an empty cigarette box that had been discarded near a tree, and then put it in her mouth. He bent down to try to take the package away from her. "I was concerned about the tinfoil," Tebow told the Washington Post. "SHE's ingested a lot of strange stuff since we've had her. Labs are notorious for eating stuff." Less than a minute after he had wrested the cigarette box out of her mouth, Zoe fell over. "It couldn't have been in her mouth for longer than 30 seconds at the very most," Tebow said. "She just collapsed on her side. She couldn't stand up." At first, he assumed the dog had eaten something the night before that she was now having trouble passing. When Zoe didn't respond to his nudging, he picked her up and carried her back home, a short distance away. Tebow called his wife at work using FaceTime. Soon, Zoe's eyes began rolling toward the back of her head, her tongue was hanging out, and she was laboring to breathe. "It became clear that these were not just digestive issues. It was really my wife who urged me to call the vet hospital," he said. Zoe was getting progressively worse. Tebow loaded Zoe into the back seat of his car and whisked her to a nearby animal hospital that was open early. When he arrived, the doctor asked him to go over what had happened in the morning. "She kept bringing me back to the cigarette box, asking was there anything in it," Tebow said. "Then they asked me to step out of the room. No more than 5 minutes later, they called him back in." To his shock, Zoe was upright and alert, as if nothing had happened. The veterinarian told Tebow they had given Zoe a dose of naloxone, the generic form of Narcan, a medication used to counter the effects of an opioid overdose. "I had never heard of Narcan before," Tebow said. "I was in complete disbelief. I couldn't believe it." Krista Vernelecken, a veterinarian and medical director at Bolger Veterinary Hospital, told the Boston Globe a variety of clues had led them to suspect Zoe may have come into opioids. That a collapse happened in an otherwise healthy dog who was fine just 5 minutes before, and knowing the dog had chewed on something on the street, there was a limited number of things that could be, Vernelecken told the newspaper. Tebow said doctors told him Zoe would have probably died if she had been brought in even 20 minutes later. He is alarmed to think about what could have happened if a child had come across the cigarette box, which was resting near where the school bus picks up his children every morning, he said. "My wife and I moved out here from Metro Boston," he said. "We picked Andover especially for its schools and its great reputation as a town, and here a puppy almost overdoses right on the corner where your kids get picked up by the bus." It is unclear what Zoe ingested. Even trace amounts of some opioids, like fentanyl, can be fatal to humans. Last week, President Trump formally declared the opioid epidemic a nationwide public health emergency and pledged resources to address the scourge of drug addiction. As the Washington Post's Lindsay Beaver reported, more than 28,000 people in the United States have overdosed on opioids and died since 2014, according to the Centers for Disease Control and Prevention. "We can be the generation that ends the opioid epidemic," Trump said. "We can do it." Vernelecken told the Boston Globe she has treated 3 similar cases of opioid overdoses in pets this year, and that no communities are off limits. "I think it's very much a misconception in the world that drug issues only happen in certain cities or regions," she told the newspaper. "I think it's just a reminder that this epidemic is everywhere, and it is not just poor communities dealing with them." Tebow said he called police on his way home from the veterinary hospital to report the cigarette box. By the time he reached the street, the package was gone. "It could have been anywhere, to be honest with you," he said. "The highest probability is it's in that pack of cigarettes. We kept Zoe away from the street for a good couple of days just in case." About a week and a half after the ordeal, their puppy is now back to normal. Tebow said the incident has made him even more aware. "You hear about these epidemics, but because you're not taking part in them, you feel so distanced from it," he said. "This whole issue really hit home. It really was a big wake-up call, to be vigilant, to watch your surroundings, to just know that this could happen to just about anybody." Read more. See how deadly street opioids like elephant tranquilizer have become. Trump says opioid crisis is a national emergency, pledges more money and attention. A shocking overdose photo exposed her addiction, and may have saved her life.